Okay, so Healthcare Pathfinder, we are a healthcare advisor, advocacy, and management firm, helping people manage their health and long-term care insurance, and really helping people through the whole process. Just to give you an idea, from consultation all the way through to ongoing advocacy and management of their insurance. So today we're going to talk about 2022 open enrollment and what you should do or what you should know and do. So we're going to talk about assessing and what you sort of anticipate to experience next year in 2022, what type of services, how to compare and choose your plan, and then the enrollment process and confirming to make sure you actually have your coverage for 2022 and to make sure you keep it throughout the year. So I'm just going to tell you my main reason for doing this, and let me back up, is Therese Lestick is on this call as well, and the two of us have worked on and off together for 20 years in the same space as helping people manage their health insurance. Therese has work for HealthNet, and she's got disability specialty, and she really does a lot of the claims management. And I do a lot of everything, but I'm a nurse and a certified case manager. And we've just seen what has happened to people based on what kind of insurance they have. And it's just very important to sort of understand what you're getting, because you never know what's going to happen. In fact, I have a new referral for someone who's in a horrible car accident. And this will be the third time in 2 years that I've had clients with severe car accidents. So it makes a big difference as to what kind of insurance you have. So thinking of looking forward to 2022, you want to think, before you start looking at the plans, think about your medical visits, the doctors that you're going to. Are you going to just primary care doctors? Are you healthy, or are you going to specialists? I'll get her letter in. And rehab, are you going to physical therapy? Are you going to have a planned surgery and you're going to have to go to acute rehab, which is hospital level rehab, or a skilled nursing facility? There's also the other rehabs related to mental health and your well-being. So there's a lot of things to consider here. Diagnostic testing. You need to know where how often are you doing that? Is it on a regular basis? Where you're getting your testing done, where you're going to these facilities. And then prescriptions are sort of almost a whole nother ballgame because they're sort of entwined into your coverage. Sometimes they're very separate, especially if you have group coverage. You may have a totally separate plan for prescriptions. And then preventative care, which is for these Affordable Care Act plans, the preventative care coverage is included in your benefits. And we bring it up because it's important to know that that's covered under your plan. A lot of people don't take advantage of having their annual physicals and mammograms or colonoscopies when it's the right time. So these are the things to think about. And I haven't added in, my page is not moving. Let me see what I can do here. So first of all, I didn't include dental and vision because those are very low cost items. You can get it. It's really up to you. I recommend you call your dentist office and ask them what they think. Sometimes it's a wash for the amount you pay. So if you have questions about it, I can talk to you more. The other thing that's important to know or think about is your doctors, whether or not they accept insurance, number one, and whether they're in network or out of network. And that's where you have to start thinking about that when you're looking at your plans. So in network means that your doctors accept your insurance, not just the company, not just the name, but your actual plan. So there's a difference between group coverage, group Connecticut or group Cigna, and individual. So there's different contracts, different providers, there's different networks. And then on the out-of-network side, that's for doctors who don't, or providers who don't participate or have contracts with the insurance company. So you've got to think about those dollars. How often is that happening? And do you need out-of-network coverage? And chime in and actually unmute yourself if you have like a dying question that you really want to ask throughout the presentation. Otherwise, I'll wait till the end and we can, go through all the different questions then if you have them. Okay, so now let's dive into searching and comparing your plans. So where you can do this. So we're in Connecticut. This is for when we're talking about the individual. This is really focused on individual for this, but even for group coverage, that would be your HR department. But Access Health CT is the state of Connecticut's marketplace. If you're out of state, it's all different as to whether they have their own marketplace or you need to go to the healthcare.gov to search your plans, but that's always actually a safe place to go. And you put in your zip code and you find out whatever state, in case you're moving or something of that sort. You can talk to brokers, some great brokers out there. The important thing to know with brokers is they are selling and they get paid commission by the insurance companies. Some are really great. Some, it depends on the depth of the search that they do and really understanding the experience. I don't know a broker who, I'm sure there's plenty out there who have the experience that Teresa and I have had. So that's where Healthcare Pathfinder comes in to really help you understand what your experience is going to be with the plan you're buying. So that's really when you, regardless of who you're talking to, important to let them know what you're, what you need in looking for your coverage. And as I've been holding off and saying, it's not just about the money. And often when you call the state plans and get information, they're often going low on not wanting to spend money on premiums. And they're not thinking about people who might be willing to pay more to have a better experience. So just when you're talking to people about it, people compare premiums, but it's a lot, you really have to go through this process to figure out what's going to work for you. So types of plans. So you have HMOs and EPOs. So this is health maintenance organizations. So it's sort of, these are the and the EPO is exclusive provider network. So if you look at this, you have in-network only benefits, basically for providers. That means in the state of Connecticut, you have an HMO plan. And so you go to Stanford Hospital, that might just be your network, is the doctors within the Stanford Hospital network. You might not have the whole state of Connecticut. It depends on the plan that you're on. So that's very restricted. You have a primary care doctor. You have to have a PCP and they require referrals. The EPO can sometimes be a little bit more flexible, but what you'll see primarily is HMO. And then the POS is point of service. So it's basically you have access to the whole Connecticut network, but there are some restrictions. So you don't necessarily need a PCP and you don't need the referral, but there are some restrictions. You have to choose your network within the company. And I'll explain a little bit more about that later. With the ambulances, it's just saying that they will cover for emergency services outside of the network. Again, you have to be very careful with that. You have to be notifying the insurance company. It's just not as loosey-goosey. They're really managing things closely, and you need to communicate with your plan when it comes to networks. The PPO is preferred provider organization. So that gives you access to any provider physician who has a contract within the state of Connecticut. I'm talking about the individual type plans. not necessarily within the state of Connecticut, excuse me. Connecticut, the two plans that are going to be offered to companies, insurance companies for the individual plans is for 2022 are still Connecticut and Anthem. Connecticut is now offering a PPO plan that goes outside of Connecticut, and it goes tri-state. It's Connecticut tri-state, and then now they have a national network. So they contracted with a national company. So that's a new plan that will be something that I'm much more interested in for a lot of my clients. So hopefully that made some sense to you. Okay. And then also I didn't, so no PCP required and no referrals. You get to choose who you go to. So that's, you're going to pay more for these types of plans. And out of network coverage, there is out of network coverage, meaning you can submit claims for doctors who do not participate with or have contracts with your plan. You submit them. But it depends on, which I'll talk more about, is your deductibles. In the past, and this might be familiar to you or not, is on exchange, off exchange type of plans. The on exchange marketplace, or what I've been sort of focusing on, their Access Health CT. Their networks are a little bit more limited, meaning they're primarily state focused. Or you can go smaller with the HMO, and then you can get a subsidy. So this is important for people with the subsidy side because of COVID. They still have increased their limits. The availability for people with higher incomes can actually get a subsidy. You have to watch out with subsidies is you don't necessarily have to put in your income and sort of take advantage of the subsidy now. If you're not sure what your income is going to be, you can sort of say that you're going to do it. You want a subsidy, but you're going to wait until the end of the tax season until you know what your income is done. And then your accountant can help you figure out whether or not you qualify. So that's important. Other thing with the subsidies is that, and I find it very, and sometimes an issue with children who, come back from college and they go on to these plans and they have no income. And so then they end up on sort of husky Medicaid type plans, and that can be absolutely fine. It's just, you have to be aware that is state-based only care. And it's more the network or the physicians who participate are often, they're very limited. So I'll stop on that, but if you have questions later, we can talk about that. Sorry, off exchange. You have brokers who can sell policies that are not directly through the exchange. They have different networks. Now that Connecticut is offering this PPO with this national network, it may take away from some of the off exchange plans that people have chosen in the past couple of years. There can be a larger network. There are plans. Unfortunately, the state of Connecticut doesn't allow you to, on the individual market, you cannot get plans that have pre-existing condition exclusions. If you live in some other states, you can get these types of plans if you're healthy and you qualify. And then there's no subsidy with these types of plans. All right, so deductibles. So I have that $6,000 deductible where everything, all my services get paid out of pocket before the plan kicks in. But I pay for the services that are the rates, the amount I pay is a contracted rate. So for example, if the doctors, you have surgery, you get $10,000, gets submitted as a claim to the insurance company, their contracted rate might be $5,000. So all I would have to pay is that $5,000, not the $10,000. So until that deductible gets met, then we go from there. But so you have to be careful in choosing your deductibles, and I'm going to go through the plans. It's just, they're confusing. So you can go for the high deductible. That's great. You have out-of-pocket expenses, but there's other experiences that you can have as well. And if you are have maybe chronic conditions and you're going to the doctors a lot, it may be not worth getting a high deductible with the lower premium. You might want to pay a higher premium for a better experience and not having to deal with all the bills that come in. And that's where you may consider a plan that has copays, where you go to your doctor or your specialist and you pay $20 for the visit. You don't get a bill. That's all you pay. And I recommend that for people who do have sort of the chronic illnesses, but it's also a great plan for for if you have children who are going off on their own plan and you can afford it, you can do a deductible combo, but for primary care doctors and specialists, you might want them to have a copay so they're not dealing with their bills. And again, that's for people who can afford to pay more. But I also have clients, we've had clients who they have children with some form of disability, and they just can't handle figuring out what to pay. So they go on these types of copays. So the copays, some plans they tend to be more expensive because the insurance company has to pay more out of pocket. And then you have a co-insurance. So this co-insurance applies to, it's confusing. So you have your deductible, you meet your deductible, you're like, oh yay, I'm done, 100% coverage. Some of the plans have a co-insurance after you meet your deductible. That's where you pay 10 to 20%. So again, when you're looking at things, the co-insurance, we could put that aside. It can have a major impact, but it's not like choosing your deductible or choosing a copay plan. So when you're looking at plans, the deductible and the copays are the most important things to look at. Okay, I know your eyes are glazing over, but let me talk to you about the out-of-pocket maximum. So the out-of-pocket maximum is the maximum amount that you really should have to pay for in-network doctors, okay? And there's an out-of-pocket maximum on the out-of-network side, but just to keep it simple, you meet your deductible, you have a co-insurance that will get you to your out-of-pocket maximum. And then then you have 100% coverage, hopefully, depending on your plan, but that's pretty much should be it, unless you're out of network or your doctors don't accept the insurance and you don't have out of network. That's just you're out of your own pocket. Okay, and another choice you have to make, do you want the health savings account? Or can you, the advantages of this is it's tax, you have 3 tax advantages because it's you basically get to write it off for taxes, the amount you're spending. It's like you have to set up a whole separate account, first of all, to have a health savings account. You have to contribute money to it. If you're on the group side, your company may contribute to it. They may contribute to there's all different types of savings accounts that you can have. I don't want to confuse you but on the individual side, it's a health savings account. For an individual, the maximum contribution is for 2022 is $36.50. It went up $50, I think. If you're 55 plus, you can contribute another $1,000. If your family is 7,300, you use this money to pay anything that's related to your medical costs. So this becomes a health savings account. You can save it for the rest of your life. You can spend it when you turn 65, but you can't contribute to it when you turn 65 and go on Medicare. But you have to qualify for health savings accounts. And when you go and look through, which I'll show you here, you'll see that this plan this is what a summary of benefits that you can look at your plans. And the reason this one qualifies for health savings, if you see on the bottom left, if you look at the deductible, the minimum deductible to qualify is $1,400 for an individual. and it's $2,800 for a family. So this one, this definitely qualifies here because the deductible is pretty high. If you have more questions about the health savings account, I can go into it, but we just have a fair amount more to go through. So I just don't want to spend too much time focusing on it. But so in looking at this, as we've gone through everything, this is what you should look at, is the summary of benefits for the plans that you're interested in. So as I talked about, you've got the individual deductible, the family deductible. So on an individual basis, you meet the $6,000. If you have 3 family members and your combined equals $12,500, you've met your deductible. Then on this plan, do you see where it drops down and you've got this out-of-pocket maximum for the $6,900 per member? That means you've got that gap there that you have to meet before you meet your out-of-pocket maximum. So you've got the $750 that you're going to have to meet. No, sorry, that's $650. You have to meet for out-of-pocket. And what is that coinsurance? It's 25% coinsurance. So you're going to be paying 25%. Once you meet the $6,250, you start paying a 25% coinsurance. So I'm showing you the high deductible type plans. If you have a coinsurance type plan, you may have if it's this platinum plan, you may not even have a deductible, and you may have, all copays for everything. Oops, sorry. I just didn't expect that to happen. The out-of-network side, most of these plans, the minimum out-of-network is about $15,000. So just to help you understand, and Teresa and I deal with clients who meet these deductibles. I mean, we do, but we also save their out-of-network claims to make sure they're going to get there before we submit them. If you get $1,000, if you go see a doctor who doesn't participate in, your insurance, doesn't accept insurance, it's a $1,000 bill. Do not bother submitting that to insurance. But if you did, the insurance company is going to process it, that $1,000, down to their contracted rate, which may be $500. And then once you meet the $15,000, that's only $500 that's going to get applied to your deductible. Once you meet that $15,000, there's going to be a coinsurance for 50%. So now you're to $250 that you're paying after that. So you just have to really think about, this is catastrophic. And, if you have to go to some doctor who's in another state or whatever, and it's an out-of-network, sometimes you can negotiate with them, but I'm not going to go into too much about that. But it's just important for you to understand the out-of-network benefits. Even if you have group out-of-network benefits and your deductibles say $5,000, you kind of almost have to half the amount that you'll get reimbursed, and then you owe the provider the balance. And then insurance is going to cover only half of it, maybe. I hope that makes sense. So then the enrollment process. So we've gone through the whole process of looking and trying to figure out what's going to work for you, whether it's going to be high deductible, out of pocket, copays. I'm thinking Therese might have some other thoughts that I have. What I didn't put in here, and I didn't pull it up, was your prescriptions, because sometimes it's separate. You have a separate deductible for your prescriptions and different copays based on your deductible. Once you meet the deductible, you have coinsurance, and then sometimes or copays, depends on the tiers. Again, when you end up with prescriptions that are very expensive, it's really important to dive into the cost, the level, if they have tiers, whether it's brand, whether it's specialty. You really need to go into detail with figuring out the right plan for you. Okay, so the enrollment process. So you can do it online with Access Health CT, you set up an account where you can call them up. And I related to your HR. I know they offer, with group policies, they offer a lot of educational sessions. Really great to listen to them, but contact your HR department if you have any questions, or whoever the contacts are related to your benefits. I've just found with the group coverage, you've got to be really careful about the changes they make. I've just been dealing with retired teachers, and it's a crazy what's gone on with the plan changes that they've done, and the costs going up and the benefits are less. So make sure you know what your plan is, and maybe don't just automatically renew. So you can do, as I said before, you can do it through Access Health CT. You can do it through healthcare.gov, which in Connecticut would forward you to Access Health CT, talk to a broker, or Healthcare Power, Teresa or I. Okay, so once you do your enrollment, it's very important to get confirmation. Even from the initial enrollment, you should get, either you ask for them to send you emails, or they'll send letters in the mail confirming your enrollment. And then you need to get, and then often you'll get a separate letter telling you, what you owe. Where I find it's important to even call the insurance company or Access Health CT and say, I haven't gotten anything regarding my premium. How do I pay it? But you need to give them at least a week to process the enrollment before they're going to be able to tell you anything about premium. You'll know the amount of premium, but you won't necessarily have the bill, or they won't have the bill. Once you have the confirmation, you've paid your premium, it's 2022, you need to notify all your providers that you've changed plans. Now I'm sort of doing this thinking that you may have if you've just changed your plans within Connecticut, your plan has canceled, the other one cancels. If you're going from Anthem to Connecticut, you need to make sure that Anthem to Connecticut, you need to make sure that Anthem plan gets canceled. If you're on auto pay, you want to make sure that auto pay is stopped, and you want to check your bank account that next month to make sure it didn't go through for some reason. You have a month to pay your premium into, say, your effective date is January 1. You have until the end of January to pay it. I advise that you pay at the beginning of the month, or even a week before the month begins. And just a tip, if you're on Cobra, never go past the beginning of the month. Always pay the month before the effective date, because your Cobra can cancel. All right, paying premium. Very important that you do auto pay or something. I've just had 2 people who their plans have been canceled. And one, she meant to set up auto pay and forgot. And several months later, she must have just not read, and she did move, but she must have not opened up any of the documents and that she received from the insurance company. If you receive letters, envelopes from the insurance company, open them, because they can't email you that there's a cancellation. And I think I've gone over, but besides that, questions, I'm done. So just, as I said, and Teresa's just dealt with someone who's on Cobra, and the payments didn't get through, or it was doubled payment, went to one member of the family and it didn't go to the other. So I'll stop sharing, but I put my contact information in the chat if anyone wants to contact me. And I'll stop sharing. I know there's a lot of information, but I don't know how else to do it. I hope it was helpful.